Next, let's welcome Aaron Mattis, the creator of Active Isolated Stretching and Strengthening. Aaron is an author, clinical director, and international lecturer who's integrated BioFreeze into his practice for years. Before showing us a few unique treatments, he's going to share his thoughts on ProSage Heat with Perry.
Aaron, welcome to Pain Management with the Masters.
Thank you. It's great to be here.
Glad to have you here. As you know, this program is about learn more, heal more, and achieve more. And I'm honored today because I've actually been on the table and had you work on me, and you do unbelievable work. With that in mind, can you share with the therapists watching this program a little bit about what active isolated stretching is, the Mattis method?
It's evolved over the past 35 years into a method of working deep tissue, applying the effort of stretching to the muscles and the fascia simultaneously while increasing the blood flow, oxygen, moving the lymph, etc. So it's become a universally accepted method of stretching, and it's been incorporated into the athletic world as well as the area of rehabilitation, etc. It's safe for geriatrics down to children, so that's what's so nice about it.
I know that I've had a problem with my hips and my pelvis, and you worked on that, and I was a different person after that. Can you share with us how ProSage Heat enhances your therapy?
Well, dealing with people of all ages and all kinds of problems, I'm sort of a court of last resort on many situations where they've had pain for a certain number of years. I find it very effective when we take the cast off and we're working with the individual the tissues are very fibrotic and a lot of scar tissue, etc., that we're dealing with that enhances getting the blood flow and getting some of that initial shock of the pain of trying to move that just getting out of the cast. And the same thing with injured athletes that come in that have a lot of spasm and deep adhesion tissue there that has been with them for a long time, because quite frequently it's treated passively before we ever get them. So it's been very helpful because I can do this without the slipperiness of traditional oils and things, which we tried to do for years.
So it's the controlled glide and the heat.
Control, glide, and heat into those receptors.
One thing I know for a fact is that you've been using BioFreeze for years. In fact, you used it on me when you were finished with me. Can you tell us how it's used in your therapy and your patient care protocol?
Of course, when you have injuries that are more severe, such sometimes you see in them they tore a muscle and or they had a problem where the joint was severely injured, to get the swelling out of there, and of course cold is effective, but combining the cold effect of the BioFreeze and then enabling them to continue on as they go home. But when we have such an injury, we place the BioFreeze on and work with the tissue, perhaps stretching some of the tissue, and then following that we may use BioFreeze again as a final capping and take a ice cup and drive this into the deepest tissues where that you may not get it just with your hands alone.
Well, that's insightful, and I hope some of the therapists watching take your recommendation. We look forward to seeing your work on the table.
Thank you for inviting me.
Thank you, Aaron.
We're going to demonstrate the benefits of active isolated stretching and its effect upon the knee joint. To begin with, I would use ProSage on some of the difficult areas that need some warming up properly. I'm not going to demonstrate that for the purpose that many of the masters of these techniques, such as George Kozlais, James Waslowski, Michael McGillicuddy, David Kent, and just to mention a few, will use these specific techniques to spread this tissue before we begin lengthening it. Assuming that I've already lengthened this tissue in a warming fashion, now I'm going to continue the process down into the deepest layers of tissue to the cellular level. And in demonstrating that, I'm going to use active isolated stretching. To begin with, we're going to work on the hamstring region, which is in the posterior part of the leg. The hamstrings are very difficult muscles to work with because they cover so much territory, and you can't stretch them with just one technique. So to begin with, we're going to offer the opportunity to learn that when a muscle on the opposite side of the joint contracts, such as the quadriceps, the hamstrings will reciprocally relax. The brain, the spinal cord, all the receptors, and the cells themselves get involved in the total process. So you should see a gradually lengthening process. And now we're involving the patient. Quite frequently our techniques are passive. We don't involve the patient. But with this technique, we actually get the patient involved in the process. So she's contracting her quadriceps and reciprocally the distal end of the hamstrings, the biceps femoris, the semitendinosus, and semimembranosus are being lengthened. And as you can notice, we're gaining very rapidly on the length of the tissue, including the overlapping fascia. We get the patient involved in the process so that we have a home approach to this also. So by using the rope or any other strap to assist, she's going to contract the muscle, and she now is empowered to use not only her own muscles, but to have an assisted measure of starting to work with it. To get into greater specificity, we turn the lower leg outward approximately 25 degrees, which is the full capability of the knee. And in straightening out the leg now with the lower leg, the tibia rotated outward, we are now going to isolate the semitendinosus and semimembranosus on their distal attachments, an area that's very difficult sometimes to free up and takes a lot of massage work. To turn the foot, the lower leg, the tibia medial, now it's transferred. The other hand is going to guide, and as she assists now, we'll get the very difficult biceps femoris. The two head comes down below the bottom of the joint, and in stretching that out, this is an area quite often people have a lot of pain. Continuing on with the hamstring further, we now extend on upward into the belly toward the ischial tuberosity. Now we're going to work with a straight leg. The knee is locked throughout the motion. The foot is relaxed so we don't get the gastrocnemius involved. And as we lift the leg, we're progressively going to be open the leg. You'll notice we've started from a basic position about 75 degrees, and we've gained about 30, 35 degrees in just a few repetitions. Now, very seldom do people work the oblique fibers of the hamstrings. So we're going to turn the entire leg medially from the hip, involving the femur, turning inward. And now you'll notice we've lost distance because now we're incorporating the oblique fibers called pinnate fibers, and very seldom are they stretched. And I feel this is the area most frequently strained in a hamstring injury. So by turning the leg inward now, we are isolating the semitendinosus and semimembranosus muscles from their belly all the way up to the ischial, and including those oblique fibers. In turning the leg outward, we're now going to isolate the biceps femoris. Possibly some of the tightest tissues in the human body are the outer bicep femoris. And you can notice she's having difficulty moving in this plane. Now we have to go across the plane toward the opposite shoulder with the knee extended fully. As soon as the knee bends, the stretch is disengaged. And we're now stretching the outer biceps femoris. Once again, we're into the pinnate or oblique fibers in addition. You can notice that we are gaining 2, 3, 5 degrees every motion that we're doing, gaining range very rapidly. 1.5 to 2 seconds is the time. We don't hold a stretch longer than that, otherwise we violate the stretch reflex, irritating the tissues we're trying to stretch. Continuing from there, we're going to go into the tensor fascia lata, the iliotibial band, starting above the crest of the ilium, coming down below the knee and attaching. So it makes it a two-joint muscle. Traditionally, people would try to stretch the tensor fascia lata by crossing the legs and leaning downward. This is an eccentric contraction where the muscle is actually working and not stretching. So to get around that problem, we wrap the rope around the outside of the leg, keep the knee extended, and come straight across the opposite leg. Now the adductors are stretching the abductors, including the tensor fascia lata and gluteus medius, which takes the pressure then off the iliotibial band. This is getting the distal end of the tissue primarily. From there we go to a vertical position with the knee extended and come straight across the opposite hip. Now we're going to open up the deep tissue along the side, all the way down to the middle of the band. And this tissue extends inside the hip joint itself, is one of the problems we have with deterioration of the hip itself, I feel. Now, following this work, she has a problem and down in her iliotibial band. I'll have her turn on her right side, please. Now, at this point, I'll use something that has a cooling effect and will offer deep into it. So now I'm going to use BioFreeze. BioFreeze is something that she can also take home with her and use at home for part of her home assignments in her healing and rehabilitation. So starting down here, we're going to do some effleurage. Right down in the attachment where it's been sore and work around that. Come across the fiber, do some deep friction work with here, and a very gentle nature, working the biofreeze in so it can have its full analgesic effect. Once these tissues have been lengthened and relieved, now she's going to go home and do some of the same homework, and some assignment of strengthening of these tissues also going to be part of her program. She should have a result within 1 to 2 sessions, near maximum. These are a few of the techniques that I would use around the knee. And in addition, the using of the ProSage has been helpful to get the body warmed up to begin with. And in closing, you want to use the biofreeze now for the pain element and a continued analgesic effect that she can do at home whenever she has a problem. And her homework would be assigned. So these are some of the things that we would do on a consistent basis. Thank you.
Very well done. Now you know why these folks are the leaders in their profession.